So with emergence of new variants like Omicron and a global surge in pandemic cases, Government of India has just started vaccinating teenagers and opened up for booster doses for senior citizens. Hello everyone, I'm Dr. Reshma, ER physician from NH Bangalore, and right now with me I have Dr. Srinath Kumar T S.
Hi.
Hi. So he is a senior consultant and head of emergency department here in Narayana, Bangalore. So he is here with us to help us understand more about the booster doses that we have started.
Yeah. Hi everyone, I'm Dr. Srinath. Please go ahead, Reshma. Hi.
So, sir, can you tell us first about the vaccination status in India?
As of yesterday, there were about 1.62 billion people who are being vaccinated, and 85% were vaccinated with first dose, and still there are about 35% who are not vaccinated for the second dose.
Okay.
That's the current picture in India.
Okay. Can you tell us what and all vaccines are available in India right now?
So we have 3 approved vaccines, that is Covaxin, Covishield and Sputnik. Sputnik, there are 2 doses, which are Sputnik 1 and Sputnik 2.
Okay. So what about the first doses and second doses?
Both the doses, initially the Covishield was given at a difference of 28 days. Now the government of India had said about 6 months back it is 84 days, whereas Covaxin is 30 days apart and Sputnik is 4 weeks, that is 28 days apart.
Okay. So recently we have started opening up for booster doses. Who are eligible for these booster doses?
It's a great moment announced by the Prime Minister of India. It was a very well thought by the government of India. So they considered the request from all the scientific content from the ICMR and took into all the experts into picture, and they said that yes, this is the time where the healthcare workers has to be given the boosters. Along with that, 60 plus years, those who have completed their second dose and also with comorbidities, they have told that these people also should be given the booster dose, and it's called as precautionary dose rather than the booster dose.
Okay. And why do we require the booster dose?
As you and me are aware, we are all healthcare providers and we are the one who received the vaccine in the first phase. That is first on January 16th and then the second dose started on February 16th onwards. So it is nearly 10 months up, and most of the healthcare workers were falling ill. So that was a very well thought process. So that is the reason why they felt that the antibody titers were coming down across the world. So this was the thought which was taken up and said that okay, now is the time that healthcare workers has to be provided by the precautionary dose and it should be continued.
Okay. So the vaccine based immunity is declining. So to prolong the immunity, we are taking the booster dose.
Yes.
Okay. And when should we take this booster dose?
So the government has framed a rule saying that it should be 9 months apart from your second final dose.
Okay. And if I'm eligible for booster dose, but if I get COVID infection, can I take the booster dose?
No, already the COVID infections are started to you. So it gives its own immunity. That's a natural immunity which develops because of the infection. So you have to wait for 3 months to get your booster dose.
We are seeing many fully vaccinated people coming again with COVID infection. So what is the point of booster dose now?
Very well asked question, Reshma. So that is a question most of the people keep asking us also, you know that. So what is the idea behind this is when we have taken, Narayana itself has presented a research article which has been published in American Journal of Infectious Diseases. They have taken about 14,000 people who are fully vaccinated and saw the infection rates which have come up in the fully vaccinated people. So when they saw that one, the healthcare providers or the people who have been vaccinated, they saw that the symptoms and the presentations into the hospital was in the milder form. So that's a big advantage of having a booster dose or fully vaccinated people.
So it reduces the need for hospitalization.
Yeah.
So a burden, economical and social burden will come down.
Yes, exactly.
Okay. So is the booster dose mandatory?
Yes, it is mandatory, but it is not compulsory. It is the wish of the person who wants to take it. But if you ask me as a healthcare provider, surely you should take a booster.
Okay. So do we need a certificate from doctor to get the booster dose?
Not required. For the healthcare providers, they can walk in and take the booster. But for 60 plus years with comorbidities, they can also walk in and take.
So, but it is advisable to get a doctor's opinion?
It is initially been made mandatory by the government, but then they came back and said that not required. They can just walk in and take the vaccine.
Okay. I think we have cleared lots of doubts about booster doses. Thank you, sir.
I think one more question I would like to ask you. So, where do you register these people?
In the CoWIN portal.
Yes, correct. So, they have to register on the CoWIN portal to get their certificate of the precautionary dose.
Okay. So, after 9 months, I think the link will be available in the CoWIN portal, and I think they have been getting, those who are eligible are getting SMS notifications also.
That's right. Yes. That's a great initiative again by Government of India that they have initiated, and automatic messages have been forwarded to the people who are eligible to get the precautionary dose.
Thank you, sir. Thank you for clearing all the doubts.
Thank you very much, Reshma. Have a nice day.
Thank you, sir.
Thank you.
So, and now to talk about pediatric vaccination, we have Dr. Sagar Hiremath. He is a senior pediatric consultant and intensivist. Hello, sir.
Hello, Reshma. How are you?
I'm fine.
Thank you.
Sir, is it necessary for children to get vaccinated?
I think so. It is necessary for the children to get vaccinated. This is because, in the first couple of waves, what we saw was most of the adults were affected. Infections in children were not known to be that much very high. And in the first wave, above 60 years were affected more. And in the second wave, middle-aged group were affected more. And vaccination have also been done only in this age group. So children neither have had infection, neither have had a vaccination, making them more susceptible to the COVID infection in the third wave or in the upcoming wave. So that's the reason why we need to now start vaccinating the children, given that opportunity has come now. So it is definitely necessary, and we should go ahead and start giving vaccination to the children. And as such, we are all now aware that the Government of India has also given permission to vaccinate the children between 15 to 18 years age group. From Jan 3rd, and many of the children, lakhs of children have got vaccinated now. So that is one good news what we have. And we just expect that to be expanded to the little more younger age group also. So let's wait and watch what happens with that.
Okay. So what vaccine is available for children?
So as of now, we have only Covaxin, which is a Bharat Biotech vaccine, has been given permission to use as a vaccination to a child between 15 to 18 year adolescents. And no other vaccine has been given permission to be used in children as of now. So we'll see in future whether any other vaccines will come up with studies and get emergency usage permission for those also. So right now we have only Covaxin.
So what are the contraindications of not taking the vaccine?
Fortunately, there are not many contraindications for Covaxin. There is only one. Say in case if a adolescent has taken the first dose and he had any allergic reaction to that, then the second dose will be contraindicated to him because of the anaphylactic reaction to the first dose. And second thing, if the child has any acute infection, as in very high grade fever or is very severely sick, then we can't give the dose. Apart from these two, there are no absolute contraindication to Covaxin as such.
Okay. So when a parent gets their children for the vaccination, what information you would like them to tell you first?
So as a doctor, when I want to vaccinate a child with COVID vaccine, I would like to know whether the child has got any underlying disease, whether he has got any, is on any regular medications for any other variable disease. And next thing, I would also like to know whether the child has got any heart disease and there are any special medications called as blood thinners like aspirin or warfarin, because this will affect the injection site and other things. So these things I would like to know from the parents. And also, I would like the parents to tell that the child is particularly allergic to any other medicines or any other food or etc. Because sometimes they may be allergic to the content, not the vaccine per se, but the other content of the vaccine. Okay. So that would be helpful for me.
So how many doses of vaccine do they need and what is the gap between those doses?
Okay, the Covaxin is complete immunization would be 2 doses. gap is about 4 to 6 weeks.
Okay.
So ideally 4 weeks, but you can extend up to 6
So
weeks. Yeah.
almost same as an adult.
Yes, same as an adult. Dose is also same as an adult of 0.5 ml only. They are not reduced the dose as such.
Okay.
Yeah.
So what are the side effects you can see after vaccine?
Fortunately, the study was a phase 3 trial which has happened in the children also. It showed very minimal side effects as such. So only 10% of children had some injection site pain, some mild fever, myalgia, headache, and rarely vomiting. The moderate side effects were seen only in 0.6% and serious side effects were seen in only 0.3%, which is very, very negligible after giving thousands of vaccines. And they had some 1 or 2 that were most of were related to the unrelated to the vaccine. So it's a very safe vaccine and very minimal side effects. So not to get scared of the side effects of the vaccination as such.
So basically same as the other
Adult.
vaccines they have been taking.
Yes. When children take vaccination more than adult, they keep coming every couple of months or 6 months and get vaccinated, have pain, fever. They're used to that. Yeah.
So what is the efficacy of vaccine in children?
So as of now, the studies have reported efficacy of 78% to be fair. We can probably stretch it up to 70 to 80%, which is a good number. But again, I think more and more data will be available over a period of months and further studies happen.
So right now government is allowing only 15 to 18 years of age.
Yeah.
So when can younger children get vaccinated?
Yeah, I hope and I expect them to give very soon. But let's wait and watch. I think government is also watching the number of infections that are happening. They're also looking, probably they will look at the age group of 15 to 18 years and decide how is their efficacy, how is the side effect and all. And if they feel it is safe, and then they will probably extend it 12 to 15 and subsequently to 6 to 12. So we'll keep our fingers crossed and hope that it comes soon.
Thank you, sir. I think you cleared a lot of doubts about children vaccination.
Yeah.
Thank you so much.
Yeah, thank you, Reshma. Thank you.
Thank you.
Thank you.